vaccinated. All right, folks, let's talk about COVID. Last night, we had a doctor on, Dr. Roland, discussing COVID vaccine, talking about also a variety of issues regarding COVID, where we stand, Omicron, things along those lines. Now, folks, hospitals and medical facilities are still struggling to handle the influx of patients battling COVID. Why are we zooming out? Guys, please, don't do that while I'm talking, all right? Today, there are over 68 million reported cases and more than 877,000 deaths. Despite vaccines being free, effective, and authorized by the FDA and CDC, only 63% of the eligible population is fully vaccinated. All right, I told you we were going to have a conversation tonight discussing this with, again, folks who are experts. I keep telling y'all, we focus on experts, not people who read medical journals, but people who actually live it, practice it. Dr. Kristy McDowell is a microbiologist and CEO, founder of Baby Scientist, Inc., Vascular Cardiologist Dr. Ashby from Miami, and an Infectious Disease Specialist, Dr. Alexea Gaffney. And so we're going to ask each one of you, and I'll start with you, Dr. McDowell. Last night, of course, we had Dr. Roland on, and he made several claims. A lot of our people who were in our chat room, they were saying, okay, now I'm confused. He said that he is not vaccinated, that the vaccines simply don't work. He argued that people can take precautions without getting vaccinated. You saw the comments from last night, your assessment.
I did, Roland. And, I respect the brother and his thoughts and his background, but I respectfully disagree. I agree. I believe that the vaccines work. I believe, although we have some numbers that have increased recently with hospitals and infections, they are not at the level in which they were back in 2019 and early 2020. We don't see refrigerated trucks outside of hospitals with dead bodies in them. So that, to some effect, lets us know that the vaccines do work. The one thing that I did agree with him was that masks work. He wanted to emphasize masks that, prevent viral transmission. I don't think many of us have access to those. You have to be in a very specialized laboratory or medical facility to have access to those. We have access to KN95s, N95 masks, or just regular cloth masks. And the one thing that he did say was masks work as a barrier to prevent. And so if we cannot afford, a Mercedes mask, then a cloth mask or double masking will do. It will help prevent the transmission and infection of the disease. And so, I like I said, I respect his credentials and all, but I respectfully disagree. And I hate that, he said the things that he said, because it is, people out here who aren't scientists and who aren't in the medical field, who don't understand these things, on a regular basis and everything that's coming out. And it gets so confusing. And so to have someone, say these things to the Black community is very frustrating, because, our numbers are some of the highest, who are dying from this virus, and my heart goes out to everyone, and I just want everyone to be safe and to be careful and to continue to wear their mask. And if you have no alert allergy to the vaccines, please get the vaccine, because they do work. Because we even though everyone isn't vaccinated as they should be, it does give protection to the virus. And so and another thing is, like, when he says things like that in the Black community, that denigrates, one of the sisters who worked on the Moderna, Dr. Kizzmekia Corbett, who worked on the Moderna vaccine. That sister, put her blood, sweat, and tears into the creation of that vaccine, and other scientists at the FDA and other pharmaceutical places around, and you just want to tip your hat to them, because those people worked hard to help us try to get through this pandemic as best as we can. And so the vaccines work. The men lie, women lie, numbers don't.
I've got some people sitting here. Before I go to Dr. Gaffney, so guy goes, Roland, the woman speaking, she's not a doctor, and I'm like, she's a microbiologist. Do you even know what the hell that is? And so, Doc, for the people who have no clue what the hell a microbiologist is, can you just go ahead and just tell them?
Yes, a microbiologist. I have my PhD in microbiology, immunology from Meharry Medical College, which is an HBCU in Nashville, Tennessee. Meharry Medical College only gives out graduate degrees, MDs, PhDs, dental degrees, and master's degrees. And so, microbiologists, we study microorganisms like bacteria, viruses, and other organisms. And so, I also have a concentration in molecular biology. And I've studied other infectious diseases such as prion diseases and things of that nature at the FDA and NIH. So that is, and the National Cancer Institute. I have also studied there. So
That's why I keep saying you got to be beware of all of these YouTube, TikTok doctors. All right, Dr. Gaffney, you are an infectious disease specialist. You also assessed what you heard last night, your analysis.
So I was deeply disturbed by the presentation of the notion that us being vaccinated is resulting in the appearance of variants or new strains of the COVID-19 virus. Mutations or variations are inherent to all viruses and bacteria as well. Microorganisms can mutate. They're not sophisticated like we are as humans with our multiple spell checks to make sure we make normal cells every time or most of the time. So the idea that new variants are coming up because people are being vaccinated is absolutely false. We saw variants before vaccines were widely available, and I can give you the dates of them. So the beta strain or beta variant was found in South Africa in May of 2020, long before we had a vaccine. The alpha strain was in September 2020 in the UK, long before we had a vaccine. Gamma was out of Brazil, and we saw the havoc that it wreaked on the Brazilian population in November of 2020. And big bad Delta. We cannot forget what Delta did to India and what it did to the rest of the world once it spread. And Delta began to spread in October 2020, long before we had a vaccine. So vaccines do not result in the appearance of new strains or new variants. That is inherent to viruses. So that is something that has to be, that's a thought or a notion that has to be absolutely disrupted. And then when we look at what's happening with the vaccinated versus the unvaccinated, and I even hate to state it that way because we have this divide in the country of vaccinated versus unvaccinated people, and it does not need to be that way. But when you look at who is being hospitalized right now, who is dying in the midst of this Omicron surge, it is by and large unvaccinated people. And even for those who do survive an infection due to COVID-19, individuals who are vaccinated are less likely to have severe symptoms, less likely to experience long COVID or long haulers, which can affect pretty much every system of the body and really is dramatically impacting people's quality of life and hits about 1 in 10 people. So we really have to be careful and mindful about where we're getting our information, what is the motive of the people who are spreading this information, and how the information is being presented. And then for those of us who are on the receiving end of the information, who aren't PhDs, but yet question the credentials of a PhD, you have to understand what you know and what you don't know. And you have to understand, what the people who are even sharing misinformation and disinformation and, who are spreading, anti-vax information, you have to be really mindful of what do those people know and what don't they know. So we have to make sure we're seeking information from credible sources. We have to understand what the consequences of our action and inaction is, especially for Black people, right? Men are more likely to die from a COVID-19 infection, right? But Black women are 4 times more likely to die from a COVID-19 infection. So how do we as a people with the least amount of vaccine uptake accept this kind of information and misinformation from people? The people are not looking out for us. They're not looking at the data, and they're not talking to people who are on the front lines, who are in the hospitals, who are in the emergency rooms, who are in the doctor's offices, taking care of people who look like us, right? The medical system has routinely failed us. Why are we setting ourselves up to go into a healthcare system that is completely overwhelmed, in some instances, rationing care and picking and choosing who gets a vent or who gets what limited resources are available and expecting them to choose us? I refuse to place my health in the hands of somebody else, especially not someone who is saying things that do not serve me and do not serve my community and people who look like me.
Dr. Ashby, I want to now go to you. I saw a series of tweets that you sent out over the last couple of days that certainly caught my attention. When we were discussing COVID back in 2020, and we saw different stories talking about the impact on the heart. Dr. Ebony Hilton, Dr. Tyson Bell, other people were on then saying, hey, it's something that we have to watch out for. Again, as somebody who got COVID last month, it was like, yo, that was of concern. And so you were talking about, again, the impact of this on folks, increase in strokes, increase in heart attacks, and also just your assessment of what you heard last night.
Well, let me tell you what Dr. Ashby said. I'm just kidding. I'm referencing Buddy last night, talking about himself in the third person. That was interesting.
Yeah.
What was that about? But anyways,
yeah.
So basically what I was trying to get across with those series of tweets was trying to reframe the discourse or the discussion around Omicron. And what I found was that there was this narrative out there of incidental Omicron, meaning that people are in the hospital and they just happen to test positive for Omicron. And what I found was that was inherently insufficient and just frankly deficient, for lack of a better word. What I noticed, and I'm actually on call tonight. I'm in my clinic right now across the street from the ER. And as I've been treating patients, what I found is that a lot of these patients who are presenting are coming in with various conditions like acute kidney injury, which is, impact damage to the kidneys, or heart failure, or, hyperglycemia where their sugar is high and they're diabetics. And they're being presented as such, but they then test positive for Omicron. And what I felt we were ignoring was the fact that Omicron, at the end of the day, is a virus that causes inflammation. And let me just be clear with some of the semantics here. You cannot test positive for COVID-19. And, I say it all the time, but the media always just says, they just say you test positive for COVID-19, but you can only test positive for the virus, just like how you test positive or just how you can get infected with HIV and you go on to develop AIDS. You can get Omicron and then develop COVID-19 or any of the other variants, but that's a brief digression. What I've noticed is that these patients are not coming in just because of their illness and testing positive. It was the fact that they had the infection and it tipped them over the edge. And in the US, we have a huge amount of chronic medical illnesses, right? We have ton of obesity, diabetes, hypertension, hyperlipidemia, and we have lack of access to care. So there's a ton of people who are being mismanaged or don't have any access. There's a lot of diabetics walking around they don't even know. And so you just slap a virus on there and that leads to inflammation. These people present with various conditions. And to me, that part of the discourse was missing. And as a cardiologist, I've seen it time and time again in previous variants, and I'm seeing it now where patients are coming in with heart attacks, for example, and they just happen to test positive for Omicron. Well, we know that COVID-19 is an inflammatory disease. And so not only does it directly infect multiple organs, including the heart and the blood vessels, but it elicits an immune response that causes inflammation and does a bunch of things, including causing hypercoagulability, which is causing the blood to clot or thrombose. And that can lead to ruptured plaques or blocked arteries, which are essentially heart attacks if it's in the coronary arteries, or it can lead to a rupture of a plaque that's in the carotid artery. So, the prerequisite is to have plaque lining the artery then you throw some inflammation on top of that plaque, which then gets activated and clots, and then it can cause a stroke. So that's the mechanistic, foundation behind that. And that's just something that we were ignoring. And, how do you explain, and this is why I was getting frustrated, how do you explain the surge in hospitalizations? Yes, there's a decoupling of the hospitalizations with Omicron as compared to prior variants, but you're still seeing a surge in hospitalizations. And to simply say that most of those patients have incidental Omicron is just insufficient. And one last point is, I think a much better indicator of the impact of Omicron or the Omicron effect is excess mortality, as opposed to just looking at mortality directly related to Omicron. And so what we saw in South Africa is that the excess mortality increased by roughly 34%. I strongly suspect that it's going to be higher in the US. I've seen it firsthand anecdotally, but obviously we have to remain scientific in our analysis. But it's the way we let this particular variant rip through our population, and we're reaching nearly 1 million cases a day. That puts additional stress on our healthcare system, which is already short, has staff shortages. In addition to the fact, again, that we have a lot of individuals with chronic medical illnesses who are presenting to our ER and unfortunately not getting adequate care because of, again, multiple factors.
I'm going to pull my panel into this in a moment to ask some questions. But I got to ask each one of you, because this is the most basic thing I keep getting. Okay, what do we do? What do we do? How are we supposed to proceed? How are we supposed to move forward? Look, when I tested positive last month, I had a staffer who tested positive, and then what we did was we went virtual for 2 weeks. It was around Christmas and New Year's anyway, and so it made sense. And so, okay, fine, we come back, we're here 2 weeks, then one staffer tests positive, send her home, and so then it's like, well, do we now go back to isolation? What do we do? You hear from the CDC. Then, of course, there are conferences and there are concerts, and people are going to football games and whatever. You've got Mardi Gras that took place. You've got the Essence Festival, the NAACP Image Awards was supposed to be at the end of February. They announced it's going to be live, but there's going to be no studio audience, presenters in person, no one else. The Grammys, they postponed it from the Grammys. They moved to Las Vegas, and so people are just sitting here going, okay, fine. What do we do? How are we to proceed? Should we be wearing gloves? Should we be wearing masks? Should we be covering our eyes? What in the world, how should we be proceeding in 2022 to deal with this? Dr. McDowell, you first.
Very, very carefully. Now, I say, proceed as we did before. Nothing is 100 proof. The mask, the hand sanitizing, the distance, all of these concerts and events, I deem them dangerous. I would not attend them myself. I'm a little shaky going into my classroom with 24 students. Just be cautious, wear your mask, hand sanitize, and keep your distance. That is, and stay away from mass crowds. Only go to the grocery stores and other stores when 100% necessary. If you have to, still utilize different apps that can bring you your food and things. And I know we want to go to restaurants. I know we want to go to these things, but we are still in a pandemic and people are still dying. And it also, I say err on the side of caution at all times. And if you value your life, do it. Take precaution. Don't take, those chances, because, the chances you take, you may not get another chance to make it.
Dr. Gaffney.
So we have to remember that there's lots of decisions to be being made right now, and some of those are public health decisions, and some of those are financial decisions in good old capitalistic America. So, when concerts are allowed to go on and sporting events and all of these mass gatherings, that has nothing to do with public health. It's actually not at all in the interest of of public health. And I think we have to be very mindful of that. We shouldn't feel like, oh, the doctors and, whoever else is allowing us to do these things, it must be safe. No. As someone's infectious disease doctor or primary care doctor, high risk, low risk, no risk at all, I am telling people, do not take chances with this virus. Do not say, well, I'm just counting on my immune system. I think I could beat it. You know what? There's parents of children who probably felt the same about their children. There are healthy young adults and older adults and even vaccinated people who felt like they could just beat it, and they took a chance, and they're not here to see another day and see, parts of their life that are so much more important than sitting at a restaurant or a bar or going to a concert right now. We will be able to do those things eventually, but right now we need to proceed with the utmost precaution. Double mask, wash your hands. I don't agree with wearing of gloves outside in public. And that is because I have observed people with gloves touching any and everything, including their face, their eyes. I've seen people, take the glove off with their teeth and all kinds of crazy things, because we're just not mindful of what we're doing. But people tend to be a little more mindful of the fact that they went up and down the aisles of the grocery store and touched the cart, and they will clean their hands and, when they get back in the car. But, those gloves are just picking up germs and taking them with you. So definitely double mask. If you have a plain surgical mask, put a cloth mask on top of it. If you are double masking, put your better mask closest to your face. So if that's a surgical mask or a KN95 or a N95, if somehow you have your hands on that, then you put that on first, and then you might put a surgical mask or a cloth mask on top of that. Does the general public need to cover their eyes? There's probably no harm in it, but the reason I wear a face shield in my office, or the reason Dr. Ashby would have a face shield on or be covering his eyes in the emergency room, is very different than being out in the grocery store. We certainly don't want to get the false idea that if
how about an airplane? How about an airplane?
On an airplane, I would on an airplane. There's nothing that is important to eat or drink on an airplane that would make me take my mask off. I had to fly to California recently, and I was double masked. I didn't drink a thing. In fact, I closed my eyes, put a hood over my head, and went to sleep. I didn't look at anybody. I didn't talk to anybody. I didn't open the vent. I just sat there and sweated.
Well, Doc,
taking chances.
Well, I'm gonna have to figure something out, Doc, because I'm supposed to be going to Liberia. That's a 25-hour flight. So I'm gonna eat something. So I'm gonna have to figure. Maybe I'm gonna get me like a portable, hood or something. I don't know. You're gonna have to send me some suggestions, because I don't think I'm gonna sit here and go 25 hours and not eat or drink. So
no, on a 25-hour flight, you better hydrate so you don't get a blood clot. But you'll be tested before you get on that flight, unlike domestic flights where we're just coming and going as we please.
Oh yeah, no. First of all, I got a massager. I'll be walking. I'll be drinking as well. But we gonna eat something. So you just let me know how we work that whole thing out. Dr. Ashby, on that point, as Dr. Gaffney was talking about when we're in stores and stuff like that. Again, I think what people are also looking at is like, okay, so what do I do? So if I'm going into a store and I'm touching packages or whatever, do I sit here and am I constantly cleansing? Am I constantly putting on gel or whatever? Do I do it before I walk in? And then do I do it, when I leave? Because I think that's what people are trying to figure out, exactly, what is that process? Because when we talk about even with gathering, it's like, in December, I was inducted into the National Association of Black Journalists Hall of Fame. I got folks who want to do an event for me in Houston, where I'm from. So the question is, do you do an event? If you do an event, what do you do? Are you checking temperatures? Are you doing on-site COVID testing? Well, somebody may have gotten infected but not showing any symptoms. And so folks are sort of, and I think a lot of this frustration that people have is that they're sort of like, handcuffed, if you will, from being able to do stuff, and then people let their guard down, like, man, look, I'm going out, I'm going eating. So they're looking for strong direction just to be able to just get through this? Doc, Ashby, your thoughts.
Yeah. So Roland, I actually have a different take than probably many of the professionals, including the panel here. What I've said from the beginning is that COVID-19 was a societal shifting event. Okay, like our world has changed fundamentally, and I don't think people or our policymakers have wrapped their mind around it. And even Dr. Roland, it's one of the things that he did say that was correct. He said a lot of things that were correct, but some of the things. Anyways, the virus ain't going anywhere. It's going to be here for the rest of our lives. We need to really wrap our mind around that. The coronavirus isn't going anywhere, and the question is, how are we going to structure society with the virus? There is going to be other variants for sure. Hopefully it's going to be less virulent, but we don't know because this virus has thrown all kinds of curveballs left and right with us. But we need to understand at what point are we going to transition from being in this reactionary phase to operating as in our new reality, so to speak. And it's important to understand that there's a couple things. I mean, and I preface this by saying that I am very big on Ubuntu, right? I am because we are, and what I do affects my neighbor, and that's very important. But it's also important to assess your own risk, okay? Meaning that if you have multiple comorbidities, if you're obese, if you have COPD, whatever, you're at a much higher risk than someone who is young and otherwise healthy. Yes, we could talk about anecdotes of someone getting a clot or thrombus or whatever, but we have to look at it in its totality in terms of the actual data, and those risks are very low, particularly if you're vaccinated. And you have to add on to the fact that Omicron is a very different virus than Delta and the previous variants. Its virulence is very different. It's an upper airway disease. It doesn't affect your lungs like the other variants do. So the likelihood of you developing a COVID-19 pneumonia are much less. With that said, again, it's nothing to dismiss. I mean, meaning that people can get very sick, and even if you don't have any risk factors, you can get very sick. So you have to, again, factor in your own risk. So my overall point is that yes, you got to take mitigation measures, and yes, you should try to prevent getting this virus, but it's pretty hard to do. I mean, there's a saying now: if you're in the same room with somebody with Omicron, you likely have it. I mean, it's spreading like the measles, but again, it's much less virulent. In terms of the actual spread, yes, you can spread it via contact. But it's primarily airborne, okay, and it's primarily also aerosolized. So the vast majority of infections are being spread that way. It's the people who are getting it from fecal or oral route or touching things is much lower. So the yield in cleaning your hands and wearing gloves is very low. Whereas again, protecting your nose and your mouth is much higher. And one last point is that, why are we not talking about treatment? I mean, the advances that we've made in treatments are monumental. I mean, we have the monoclonal antibodies, some of which are not as effective against the Omicron variant, but we have quite a few that are. And we also recently EUA approved 2 new oral antivirals, molnupiravir, or the Merck drug.
If you can't say it, I damn sure can't say it.
Yeah, I'm sure my ID colleague will be able to say it. But and we have the Pfizer drug, the Paxlovid. Paxlovid is a much more superior medication, and it's an oral medication. Why are we not talking about this? And this is unique to the Black community. Like, most Black folks I know don't know anything about monoclonals. They don't know anything about oral therapies, and these are therapies that should be given early on. As far as I'm concerned, COVID-19 is an outpatient disease. Okay, if you're getting hospitalized, if you're dying from COVID-19 at this particular juncture in the pandemic, that represents a failure of our system, which we all knew it was failing before. I mean, I'm a cardiologist, and just look at heart disease and cardiovascular disease in general. 80% of that's preventable, yet people are still getting it left and right. That's a whole nother discussion. My point is that we need to, start figuring out a way, how do we function in society with this virus here? And one very important aspect of that is deploying early therapy and linking that to even getting tests, because you don't even want to wait until you get get symptomatic. You want to get the therapy early on. The earlier you get it, the more effective it is. And not only is it helpful for you in terms of decreasing your risk of hospitalization and death, it's also a public health good, meaning that it decreases your transmissibility, and meaning the amount of virus that you transmit, and the period at which you're infected. So I just think we need to stop, being in these two different categories, because, yes, we need to get vaccinated, but we got to stop beating a dead horse. I mean, people have pretty much decided whether or not they're going to get vaccinated, and we can still talk about it. We can still educate folks on it, but to talk about vaccination at the expense of early intervention, to me, is doing everybody a disservice, because that could save a lot of lives, particularly in the folks who have put their foot down. And what you're seeing in the white populations, particularly Trump supporters, especially in Florida, because Ron DeSantis is promoting monoclonal antibody therapy, a lot of those people who are against vaccines are getting this synthetic monoclonal antibody, which makes no sense, based on logic, but at least they're getting the therapy and we are not. And the numbers are dismal. And it's unfortunate that the CDC is not tracking this at all. And I can only reference one small study, which basically showed that less than 4% of Blacks were getting monoclonal therapy. And there's also a systemic barriers related to it, given how it's distributed, mainly at the hospitals, which who put these onerous barriers in access. And that's something that New York tried to circumvent, and that's, and Trump, attacked them for that. But there really is some disparities there in terms of race and obviously economic status.
Questions, Monique Presley, she has a question, and she sent me a text. She's like, I'm confused what the hell going on. Monique, go ahead.
Yes, and I had an expletive. Thank you for trying to cover for me. Listen, I'm vaxxed, right? I'm boosted. I'm wearing my mask. I get that you all agree that those things should be happening. But it sounds after that like something of a crapshoot. And I'm trying to assess, based on each of you, your individual device, where there is consensus, where there isn't, where you disagree with the CDC. I don't even pretend. I mean, my friends call me WebMD, but that's just because I look things up before I say go to the doctor. I don't pretend to do, I do law, but when people come to me for advice, I give it. And what I feel like in this entire process, which I understand is a process in a situation that nobody's ever been in before, but what I feel like we don't get is just advice. Do this, don't do this, do this. And we get you saying from your best medical opinion and that nothing is foolproof. But for instance, I thought I heard one of you say, now isn't the time to be at the concerts or at the restaurants, and if that's true, in the middle, I'm sorry, I forgot your name.
Dr. Gaffney.
Yeah.
Dr. Gaffney. Is that churches too? Should people not be going there? And is that schools too? I have 3 teens. Should they not be going there? Or should people be going all those places masked? Or is it a question of social distancing? What are the thoughts? School, church, work, social events. What do we do?
Yeah, absolutely. And it's such an important question that you're asking. And I am speaking from the standpoint of being a person who has a very low risk tolerance. And as an infectious disease doctor and someone who's on the front lines in the first wave of the pandemic when we had absolutely nothing. So I am a vaccinated person and I am boosted and I have eaten inside of a restaurant. I'm selective though about which restaurants I will eat in. And so when I make a decision to go out to eat, I think about what is the positivity rate in the community that I'm going out to eat in. Is it out here where I live in the suburbs of New York City, outside of New York City, where nobody's checking to see if people wear masks, or if people are vaccinated when they come into a restaurant versus eating in the middle of Manhattan, where there's a higher uptake of the vaccine and people have to produce a vaccine card in order to go into the restaurant. I find that those are folks that are probably like me and may be less likely to take a risk, and so will eat inside of a restaurant.
Anyone else want to jump in?
Yeah, Roland. I would like to jump in really quick. Can you hear me?
Yeah, go ahead. Yeah,
So
Dr. Gaffney froze, so go ahead.
Yeah. So assuming that you don't have any chronic medical illnesses, your risk of having a severe, a poor outcome or severe disease is incredibly low, especially with Omicron. Okay. Yes, you may get sick, and that's very possible. But we have to again put things into context. Okay, the vast majority of individuals that are getting hospitalized or going to the ICU are those with chronic medical illnesses. And if you have those chronic medical illnesses and you're unvaccinated, you have a much higher risk. Okay, and so again, we have to figure out how are we going to live our lives. And as far as you're concerned, the lawyer, I forget your name, I didn't catch it.
That's Monique.
Monique, your risks are incredibly low. Like you have to again assess your the fear or the actual risk, and not let fear overstate that. You have to live your life. And now, if you were living at home with somebody who is on chemotherapy and very on dialysis, it's a different risk benefit analysis for you. But on top of that, you have to also understand what your options are. And for me, like my concern for getting Omicron is super low. Like my concern for my 2-year-old getting Omicron is super low. But again, if you look at it on a mass scale, it becomes an issue. Okay, it becomes a real issue.
Hold up. So is your concern it's super low because of this protective barrier that you sort of created?
No, it's because I'm vaccinated and I'm otherwise healthy. My risk of having a poor outcome for Omicron is much lower than somebody who's 80 years old, has heart failure, and is unvaccinated. And so I'm fully vaccinated. I'm otherwise healthy, and I know Omicron ain't Delta. Okay, it changed the equation, and that's why I try to look at things from an outcome and a policy level. And that's also my background. And sometimes you have to understand you don't want to have policies in place that could actually make problems worse. And that was actually a factor in the CDC's decision, because they also understood this. The CDC understood that again, Omicron ain't Delta. And then, besides the fact it's capitalist and all these other things going on, that was certainly a factor.
Got it.
But we have to understand like that in the hospital setting, we were short-staffed. And if you have people quarantining for 10 days and you have a hospital surge, people are dying because of high nurse to patient ratios. They're dying because of staying in the ER all day and getting infected there. And so you have to again, do a more sophisticated risk benefit analysis, and you can't just look at the direct impact. So again, this is where policy and immunology and virology and all of this comes together in addition to political ideology and all these other factors that are going on. And that's why I mentioned early COVID-19 treatment is incredibly important.
Just before I go to Eugene, Vice President Kamala Harris is traveling to the Capitol to oversee the 8 p.m. vote on the Freedom to Vote in the John Lewis Act. So I just want to let you know that, as Senator Chuck Schumer said, the vote for closure is supposed to start at 8 p.m. We'll have it live. Eugene, question. What's your question for the panel?
I guess my question for the panel is this. Look, outside's open. Outside's open at this point. But we're still dealing with the situation, at least here in Maryland, where 3,500 people are hospitalized right now. Most of them are vaccinated. I mean, what is it going to take to slow this down at this point, besides mandating the vaccine flat out, right?
Let's see here. Dr. McDowell, you want to start?
That's a tough question. That's a tough question because, the virus is its own entity, and we can only do what we can do. And if the virus, innately is going to mutate and try to avoid, vaccinations and whatever drugs that we throw at it. So, to me, that's hard to answer. It's like, the only thing that I can say is just try to continue doing what you're doing and be safe and wear your masks and social distance and just take precautions based upon, how you feel,
Got it.
and such. Yes.
Dr. Ashby, real quick.
So what I mentioned a bunch of things, but early on when Omicron came about, it was very clear that the majority of the U.S. population was going to get this virus and get exposed to it at some point. That's very important. The issue with Omicron is how many people are getting it at the same time. And so you're getting this big bolus of people who are infected, and a subsegment of those people are going to get hospitalized because they have, again, chronic medical illnesses. And so you made a statement that the majority of patients in the Maryland system that are hospitalized are vaccinated. Did I hear you correct?
No, they're unvaccinated.
Unvaccinated.
Okay. I was what was that about? But it is important to look at data in that appropriate way. And there's a ton of people who are saying people who are vaccinated are the ones getting sick, and that just couldn't be further from the truth.
Yeah.
But one of the big issues that people have with doctors who are traditional medicine physicians is that we are basically parroting whatever the CDC says. And it's important to realize that natural immunity counts for something, okay? And there's a ton of studies out there that show that once infected, that you do have a protection. Now, and we could talk about that forever, but it's just very interesting that the CDC doesn't report on natural immunity. And it actually makes the vaccines look not as good as they do, because if you're comparing vaccinated to someone with no immunity, vaccines are going to look amazing. But if you're comparing the vaccinated to a mixed population of those who are infected, previously infected, and those who have no immunity, then it's not going to look as effective as it is.
Okay.
But it's just important that we look at all the data all together, because
Yep.
we want to be straight up genuine when we're discussing things, and that's one of the points that I try to get across to my patients.
And that's why we have multiple segments dealing with the issue of COVID. We appreciate Dr. Ashby. We appreciate you, Dr. McDowell, and also Dr. Alexea Gaffney for joining us. Thanks a lot.
Back to that Roland Mark Unfiltered video in just one moment.
Time to be smart.
Roland Martin's doing this every day.
Oh, no punches!
Thank you, Roland Martin, for always giving voice to the issues.
Look for Roland Martin in the whirlwind, to quote Marcus Garvey again.
The video looks phenomenal, so I'm really excited to see it on my big screen.
Support this man, Black Media. He makes sure that our stories are told.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
I got to defer to the brilliance of Dr. Carr and to the brilliance of the Black Star Network.
I am rolling with Roland all the way.
Honored to be on a show that you own. A Black man owns the show.
Folks, Black Star Network is here.
I'm real revolutionary right now. Roland was amazing on that.
Stay black. I love y'all.
I can't
commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having.
Let's be smart. Bring your eyeballs home.
You can't be Black-owned media and be scared. You dig?